I'm Dr. Kendra Campbell, and I'm an emergency psychiatrist and previously ran a psychiatric emergency room in a busy New York City ER. While I was there, I started a holistic program where volunteers would come to sit and talk with patients, play games, do music therapy, aromatherapy, and play with clay, and all types of holistic interventions to help people in acute psychosis or mania or acute suicidality. What we found was that when the volunteers were in the ER, patients were way less agitated, and we didn't need to give medications to calm them down. That is a pretty huge finding, because this basically means that if you have the right type of support, you don't need medications to treat people with acute psychiatric emergencies. Now, in other ERs where there are no people for the patients to talk to or engage with, people can become acutely agitated, and for their safety, sometimes medications may be the only option available. But this does not mean that people need medications to treat acute issues. It means that we have a broken system whereby the people who really need support and engagement the most aren't getting it. And instead, they're being injected against their will with neurotoxic medications. Another important aspect here is that in my 4 years working in a psych ER, the vast majority of people coming in had recently stopped or decreased their meds. It was very rare that someone came in who had never taken psychiatric medication. And this actually makes perfect sense. Psych meds do not treat any mental illness, but they do cause them by creating a chemical imbalance. When you take a psych med, your brain and body see the med as a neurotoxin and then tries to obtain homeostasis. It does this by upregulating or downregulating receptors and changing the amount of neurotransmitters being created or being broken down. When someone stops taking their psych meds abruptly, or even if they are doing a taper but going too fast and not treating the root cause, the outcome is that the body will start having acute symptoms like mania and psychosis. So the thing to note is that most psychiatric emergencies are due to the people starting psych meds and then stopping them. The problem is that what people see is that someone was taking their meds and seeming more docile, but really they just had a chemical lobotomy. So when they stop their meds and then become manic and psychotic, the person is blamed and we call them mentally ill. But the symptoms are actually caused by taking the meds in the first place. So the only thing that's ill is the system for starting people on medications that they will struggle to ever stop. We actually have research that shows that the people who never start psychiatric medications have way better long-term and short-term outcomes. And if someone is experiencing new onset psychosis or mania, the absolute best thing we can do for them is to allow it to run its course and treat the root cause while giving a lot of support. Research shows that if we do this, the episode will clear up on its own. Versus when we medicate people, the symptoms do become chronic, but it's not because their mental illness is chronic. The chronicity is the dependence that is created with the medications and the cycle that is created when people stop taking their meds and then are forced to go back on them because we have labeled their symptoms as chronic mental illness instead of chronic abuse by doctors in the system, which is what they really are.